Now we will talk about gap junctions and connections. So what is gap junction? Gap junction is a type of intercellular connections, and it is just like tight junctions. It's a bit different from tight junctions. Tight junctions we have already discussed previously. So gap junctions is a bigger connection, relatively bigger connection than ion channels and tight junctions. What gap junctions does is that it allows passage of relatively larger molecules like glucose, amino acids, nucleotides, as well as electrolytes, but not proteins. Proteins do not pass through gap junctions, but these molecules like glucose, amino acids, nucleotides, as well as electrolytes do pass. So, what is the structure of gap junctions? Imagine that this is a cellular surface and this is another cellular surface. This is the plasma membrane. So these are essentially the units of gap junctions. This is one unit and this is another unit. So literally these two units together they form the gap junctions. And each of this unit is named as connexons. And as you can see, each of these units is divided into six parts or six units, six subunits you can say. These subunits are known as connexins. So these whole together structure is made up of 12, or this is a dodecameric structure. This is 12 subunits of connexins formed together to form the gap junctions. Therefore, two connexons make one gap junctions, whereas 12 connexins make one gap junction. The intracellular distance, as you can see, is reduced to 2 to 4 nanometer of space because of gap junction. Now let us talk about, we have already talked about connexon and connexin, and the diameter is around 2 nanometer. Now let us talk about one another important point is that connexon not only is a intracellular connection, but it can also provide a regulated conduit between ECF and cytoplasm. That is, through the connexon or through the a cell can actually communicate with the extracellular space or ECF. Not necessarily a gap junction, because for the formation of a gap junction, we will need two connexons. Now, connexon is a very research topic these days, especially connexin, and it has been realized that these connexins and connexons are not just random channels between two cells, but are highly regulated structures genetically. And several diseases have been found to be associated with connexin disorders. Remember the answer, this type of diseases have been frequently asked in MCQ, and one of the option is connexon, and the correct answer is connexin rather than connexon. So what are those diseases? These are summarized below. This is Clausen syndrome, connexin 30 defect, and then there is erythrokeratoderma variabilis, and it is connexin 31 and 33. But the most important one is X-linked Charcot-Marie-Tooth disease. The connexin here is connexin 32. There are 32. There are some other diseases like idiopathic atrial fibrillation, cataract, myoclonic epilepsy, and inherited deafness. But this one, this is the X-linked Charcot-Marie-Tooth disease, is a connexin disease, connexin, not connexon disease. This is a connexin disease, and the connexin related is connexin 32. So this is in short about gap junction and connexon as well as connexins.